Most adults over 60 have no idea this tiny seed can help keep their arteries clear. You take your statin every morning without missing a single day. You gave up the foods you love. You walk for 30 minutes every day, even when your body feels tired and your joints feel stiff. You are making healthier choices, following your doctor's advice, and trying your best to protect your heart. Then you sit in the examination room waiting for your latest test results. The nurse walks in with the report, your doctor reviews the numbers, and somehow they are still not where you hoped they would be. Maybe your medication dose stays the same. Maybe another medication is added. Maybe you leave with more questions than answers. And somewhere in the back of your mind, you start wondering, why am I working this hard and still feeling like I'm falling behind? If that sounds familiar, you are not alone. Many adults over 60 experience the same frustration. They take their medications consistently, make major lifestyle changes, and still wonder whether there is another piece of the puzzle they have not been told about. Today's video is about one of those pieces. It is not about replacing your medication. It is not about rejecting your doctor's advice. And it is certainly not about promising miracle cures. Instead, it is about understanding what current research says regarding a small, inexpensive seed that many people overlook every time they walk through the grocery store. More importantly, it is about understanding why so many people use it incorrectly and may never receive the potential nutritional benefits it has to offer. I am a wellness advocate who is passionate about helping people make informed health decisions, and this channel exists to share educational health information with adults over 60. If that describes you, let me know your age and where you're watching from in the comments below. Before we talk about flaxseed, we need to understand something about cholesterol that often gets oversimplified. Many people imagine plaque building inside an artery the same way rust builds inside an old water pipe. They picture cholesterol floating through the bloodstream until it sticks to the walls little by little, eventually creating a blockage. It is an easy picture to understand. The problem is that it leaves out an important part of what researchers have learned about cardiovascular disease. Your liver naturally produces cholesterol because your body actually needs it. Cholesterol is used to make hormones, support cell membranes, and perform many normal biological functions. One form of cholesterol, LDL, carries these fats through your bloodstream to different tissues throughout your body. By itself, LDL is not automatically harmful. The concern begins when LDL particles become damaged through a process known as oxidation. Think about slicing an apple and leaving it on the kitchen counter. Within a short time, the fresh white surface begins turning brown. Oxygen changes it. Researchers use a similar concept when discussing oxidized LDL. Once LDL particles become oxidized, they may behave differently inside the body and become more likely to contribute to inflammatory processes involved in plaque development. Now picture a river flowing between smooth, healthy banks. When the riverbanks are strong and stable, the water moves efficiently and debris flows downstream without much difficulty. But imagine those banks becoming rough, damaged, and inflamed. Small branches, leaves, and dirt begin catching along the edges. Gradually, more material accumulates until the flow becomes increasingly restricted. This analogy helps explain why inflammation matters. Scientists now recognize that chronic inflammation within blood vessel walls may create conditions that encourage plaque formation and progression. In other words, cholesterol is only one part of a much larger process. That understanding helps explain something many people find surprising. Some individuals with elevated cholesterol never experience a cardiovascular event, while others with cholesterol levels that appear relatively controlled may still develop significant heart disease. Of course, many different risk factors influence those outcomes, including genetics, blood pressure, diabetes, smoking, physical activity, and overall health. But the broader point remains the same: cardiovascular disease is complex. Which naturally leads to an important question. If inflammation and oxidized LDL are involved in the process, what role do statins actually play? The answer is that statins are valuable medications, and millions of people have benefited from taking them under medical supervision. Their primary job is to reduce the amount of cholesterol produced by the liver. By lowering LDL production, they help decrease the amount of cholesterol circulating in the bloodstream, which has been associated with meaningful reductions in cardiovascular risk for many patients. That is real science backed by decades of research. But every medical treatment has a specific purpose. Statins were developed primarily to lower LDL cholesterol production. They were not specifically designed to address every biological process involved in cardiovascular disease. Researchers continue studying oxidative stress, inflammation, endothelial health, blood pressure regulation, and other factors that influence the cardiovascular system alongside cholesterol metabolism. An easy way to visualize this is to imagine a kitchen sink where the faucet is running too quickly while the drain is partially clogged. Turning down the faucet helps reduce the overflow. It addresses one important part of the problem. But if the drain remains partially blocked, water may still accumulate. The solution is not to ignore the faucet. It is to recognize that multiple factors can contribute to the same outcome. That is exactly why researchers continue exploring nutrition, physical activity, sleep, stress management, and other lifestyle interventions in addition to standard medical care. These approaches are not necessarily competing with prescription medications. In many cases, they may complement one another when incorporated appropriately and discussed with a healthcare provider. This brings us to the tiny seed that has attracted considerable scientific interest over the past several decades. You have probably seen it sitting quietly on a grocery store shelf without giving it much thought. It is inexpensive. It is widely available. And despite its small size, researchers have spent years investigating how its unique nutritional profile may influence several biological processes related to cardiovascular health. That seed is flaxseed. Before explaining exactly how flaxseed works and why preparation matters so much, it is important to clear up several common misconceptions. Because having realistic expectations is one of the most important parts of making informed health decisions. And one of those misconceptions may surprise you. So, what exactly are those misconceptions? The first is perhaps the biggest one of all. Some people believe that a single food can completely clean out blocked arteries, erase years of plaque buildup, or replace the need for medication. That simply is not what the available research shows. Flaxseed is not a miracle cure. It is not a substitute for the treatment plan your healthcare provider has recommended. And it should never be viewed as an instant solution to a problem that develops over many years. What the research does suggest is that flaxseed contains several naturally occurring compounds that may support cardiovascular health when consumed regularly as part of an overall healthy lifestyle. That distinction is important. The second misconception is that any amount will do. People often sprinkle a tiny pinch on cereal once every few weeks and expect dramatic changes. Most clinical studies, however, examine regular daily intake over extended periods of time. Consistency matters. The third misconception is that preparation makes little difference. As you will see shortly, that assumption may prevent people from accessing many of the nutrients researchers are actually studying. Now let's talk about flaxseed itself. At first glance, it does not look particularly impressive. It is small. It is inexpensive. And compared to brightly colored fruits or leafy vegetables, it rarely attracts much attention. Yet scientists have spent decades studying its nutritional composition because it contains several compounds that have generated significant interest in cardiovascular research. Among the most notable are lignans, alpha-linolenic acid, dietary fiber, and various plant compounds with antioxidant properties. Together, these components have led researchers to investigate how flaxseed may influence multiple biological pathways rather than just one. To make the information easier to understand, let's look at 5 of the most important areas scientists have explored. We'll begin with number 5. Flaxseed is one of the richest dietary sources of lignans. Lignans are naturally occurring plant compounds that possess antioxidant activity. Antioxidants help protect cells from oxidative stress, which is one reason researchers became interested in their potential relationship with oxidized LDL cholesterol. Earlier, we compared oxidation to an apple gradually turning brown after being exposed to air. The same basic idea applies here. When LDL particles undergo oxidation, they may become more likely to participate in inflammatory processes associated with plaque formation. Some research has found that regular flaxseed consumption is associated with reductions in markers related to oxidized LDL, although results can vary depending on the study design and population being examined. The important takeaway is that scientists continue exploring whether these antioxidant properties may contribute to better cardiovascular health over time. Now let's move to number 4. Flaxseed is naturally rich in alpha-linolenic acid, often abbreviated as ALA. ALA is a plant-based omega-3 fatty acid. Unlike the omega-3s commonly associated with fatty fish, ALA comes from plant sources and has been studied for its potential effects on heart health. Several reviews and meta-analyses have suggested that regular flaxseed intake may contribute to modest reductions in blood pressure in certain individuals. That may sound insignificant at first. But your heart beats roughly 100,000 times every single day. Each heartbeat places pressure against your artery walls. Even relatively small improvements in blood pressure, when maintained over long periods and combined with other healthy habits, may have meaningful implications for cardiovascular well-being. Number 3 focuses on inflammation. Inflammation is the body's natural response to injury or infection. When you cut your finger or catch a virus, inflammation helps your body heal. The concern arises when low-grade inflammation persists for months or years without resolving. Researchers have linked chronic inflammation to numerous age-related conditions, including cardiovascular disease. Several studies have investigated whether regular consumption of ground flaxseed may influence inflammatory markers such as C-reactive protein, often called CRP. Although findings differ among studies and individuals, the growing body of research has encouraged continued investigation into flaxseed's potential role as part of a heart-healthy dietary pattern. Now we arrive at number 2. This one involves something called endothelial function. The endothelium is the thin inner lining of your blood vessels. You can think of it as the smooth surface coating the inside of every artery. When healthy, it helps regulate blood flow, supports normal circulation, and allows blood vessels to expand and relax as needed. When endothelial function becomes impaired, arteries may become less responsive and less flexible. Several human studies have explored whether flaxseed consumption may positively influence endothelial function, making this another area of ongoing scientific interest. Healthy arteries are not simply open pipes carrying blood. They are living tissues that constantly respond to changes occurring throughout the body. Maintaining their function is one important component of long-term cardiovascular health. And now we come to number 1. Ironically, this finding has nothing to do with discovering a new nutrient. Instead, it involves avoiding one of the most common mistakes people make when trying flaxseed for the first time. Whole flax seeds have an extremely tough outer shell. That shell protects the seed naturally, but it also makes it difficult for the human digestive system to break it apart completely. As a result, many whole flax seeds pass through the digestive tract largely intact. The nutrients remain trapped inside. The lignans remain trapped. The healthy fats remain trapped. Many of the compounds researchers are interested in never become fully available for absorption. Ground flaxseed changes that equation. Grinding breaks open the outer shell, allowing the digestive system much easier access to the nutrients contained within. This is why many nutrition researchers and health organizations recommend consuming ground flaxseed rather than whole seeds when seeking its potential nutritional benefits. It is also why someone may honestly believe flaxseed doesn't work when, in reality, they simply were not preparing it in the most effective way. So the biggest mistake is not buying the wrong brand. It is not choosing the wrong color. It is not forgetting to refrigerate it for a day or two. The biggest mistake is relying on whole seeds when the research supporting flaxseed's benefits has often involved ground flaxseed. Understanding this single detail can completely change the conversation. Because before worrying about dosage or recipes or expensive supplements, it makes sense to ensure your body can actually access the nutrients you are consuming. By now, you can probably see why researchers continue studying flaxseed alongside established medical therapies rather than positioning it as an alternative to them. It targets different nutritional pathways. It contains different bioactive compounds. And it represents one small piece of a much larger picture involving diet, physical activity, medication adherence, sleep, stress management, and regular medical care. But before you rush out to buy a bag of flaxseed, there are several important safety considerations every adult over 60 should understand. And some of them could influence whether flaxseed is appropriate for your particular situation. Before adding flaxseed to your daily routine, there is something important we need to discuss. Whenever a food contains biologically active compounds that can influence the body, it is worth understanding not only its potential benefits but also its limitations and precautions. That is especially true if you are over 60 and already taking one or more prescription medications. The goal of this video is to help you make informed decisions based on research, not to encourage you to replace professional medical advice or make changes without guidance. So let's talk about safety. If you are taking a blood-thinning medication such as warfarin, or if you take aspirin therapy under your doctor's supervision, it is important to discuss flaxseed with your healthcare provider before adding a significant amount to your diet. Research suggests that flaxseed has mild natural blood-thinning properties of its own. For many healthy adults, that may not present a problem. However, when combined with medications that already affect blood clotting, the overall effect could be greater than expected. That does not automatically mean you should avoid flaxseed. It simply means that coordination with your healthcare provider is the safest approach. The same principle applies to blood pressure medications. Earlier, we discussed research suggesting that regular flaxseed intake may contribute to modest reductions in blood pressure for some individuals. If your prescribed medication is already lowering your blood pressure effectively, adding another factor that may influence those numbers deserves professional monitoring. Your healthcare provider may determine that everything is perfectly appropriate, or they may recommend adjustments based on your individual circumstances. Either way, it is a conversation worth having. There is another group of people who should also exercise caution. If you have been diagnosed with a hormone-sensitive condition, including certain forms of breast, ovarian, or uterine cancer, it is important to speak with your oncologist or treating physician before making significant dietary changes involving flaxseed. This recommendation exists because flaxseed contains naturally occurring compounds called phytoestrogens. These plant compounds can interact weakly with estrogen receptors, and while research in this area continues to evolve, decisions should always be individualized according to a person's medical history. Digestive comfort is another practical consideration. Flaxseed contains a substantial amount of dietary fiber. For people who are not accustomed to eating much fiber, introducing a large amount all at once may lead to bloating, abdominal discomfort, gas, or loose stools. Fortunately, this is often easy to manage. Many nutrition professionals recommend starting gradually and increasing intake over time while making sure you are drinking enough water throughout the day. Allowing your digestive system to adjust can make the experience much more comfortable. These precautions should not discourage you. Instead, they highlight an important principle. Natural foods can have meaningful biological effects. And whenever something has meaningful biological effects, it deserves thoughtful and informed use. Now let's move to the practical question that many people ask. If someone decides to include flaxseed as part of an overall healthy eating pattern, what is the best way to use it? The first recommendation is simple. Choose ground flaxseed rather than whole flaxseed whenever possible. As we discussed earlier, the hard outer shell of the whole seed can prevent many of its nutrients from becoming fully available during digestion. Grinding breaks open that shell and allows your body easier access to the beneficial compounds contained inside. If you purchase whole flax seeds, consider grinding only small amounts at home using a clean coffee grinder or spice grinder. Freshly ground flaxseed helps preserve quality and freshness. If you buy pre-ground flaxseed, store it in an airtight container in the refrigerator according to the manufacturer's recommendations. Exposure to heat, light, and air can gradually reduce freshness over time. One commonly studied amount in nutritional research is approximately 2 tablespoons per day. That amount can be incorporated into many everyday foods without requiring dramatic changes to your routine. Some people stir it into oatmeal at breakfast. Others blend it into a smoothie. Some mix it into yogurt or sprinkle it over cereal. It can even be added to certain baked foods, although excessive heat may reduce some of its beneficial properties. The important point is consistency. Research generally evaluates regular daily intake over weeks or months rather than occasional use. Like many healthy habits, the the potential benefits are associated with long-term patterns rather than one-time actions. It is also worth remembering that flaxseed should not be viewed in isolation. No single food determines cardiovascular health. Your daily eating pattern matters. Your physical activity matters. Getting enough sleep matters. Managing stress matters. Avoiding tobacco matters. Taking medications exactly as prescribed matters. Keeping regular appointments with your healthcare team matters. These pieces work together. Think of cardiovascular health as building a house. A strong foundation requires many materials. Bricks alone cannot build the entire structure. Neither can wood, concrete, or steel. Each has a role. Likewise, medications, nutrition, exercise, sleep, and preventive healthcare each contribute to the bigger picture. When one piece is missing, the structure may become weaker. When multiple healthy habits are combined consistently over time, they often reinforce one another. That broader perspective is one of the most encouraging messages emerging from modern research. Scientists are increasingly recognizing that long-term health is influenced not by one miracle solution but by many small decisions repeated every day. Choosing to go for a walk. Preparing a healthier breakfast. Taking medication as prescribed. Attending follow-up appointments. Learning something new about nutrition. Adding a simple food like properly prepared ground flaxseed to an already balanced diet. Each decision may seem modest by itself. But over months and years, those choices accumulate. That is why today's discussion is not really about a tiny brown seed. It is about understanding the science behind informed choices. It is about recognizing that evidence-based nutrition can complement, rather than compete with, evidence-based medicine. And it is about appreciating that lasting health improvements often come from consistency rather than perfection. While individual responses vary and no single food can cure cardiovascular disease or guarantee specific outcomes, current research suggests that ground flaxseed may serve as a valuable addition to a heart-conscious dietary pattern for many people when used appropriately and discussed with a healthcare provider when necessary. If there is one takeaway I hope you remember after watching this video, it is this. Do not underestimate the power of small habits practiced consistently. Real progress is rarely dramatic overnight. More often, it is the result of simple decisions repeated day after day until they become part of everyday life. If you found this discussion helpful, consider subscribing so you never miss future videos exploring healthy aging, nutrition, and wellness through the lens of scientific research. And if you know someone over 60 who is working hard to improve their health and wants clear, balanced information instead of exaggerated promises, share this video with them. The more people understand the evidence, the better equipped they are to have meaningful conversations with their healthcare providers and make informed decisions for themselves. Thank you for watching, thank you for spending this time with me, and as always, take good care of yourself.